what's your take on the effectiveness of psychosocial treatment, and what are the goals that we're trying to achieve with psychosocial treatment?
Well, I think that medication forms the foundation for recovery, and then psychosocial treatment can really help in a number of ways. So we've developed cognitive adaptation training, which is to bypass some of the cognitive impairments associated with schizophrenia and help people to function better. So we go into their homes and we set up signs and alarms and food containers and help them set their calendars so that they don't miss social visits. We get them hooked up with Clubhouse, and we really try to move them into the community and to interacting more and to having a better functional life and taking their medication and other kinds of things. So that kind of support for people who have impairments in cognition and functional problems can be really helpful. It can improve social and occupational functioning, and it can help them to not relapse and have longer tenure in the community. We also use a lot of cognitive behavioral therapy for psychosis. And this is for people who are on medication, but their medication doesn't completely take away some of the problems with delusional thinking or hallucinations. And so CBT really focuses on helping people to deal with those persisting symptoms. And for delusional thinking, we do a lot of behavioral experiments. So if someone is afraid that people on the bus want to kill them, so they don't take the bus, we will go with them on the bus, and we will stop them from safety behaviors, things like looking down at the ground, and so they don't see the people on the bus. We get them to look up and look at who's on the bus. And yeah, there's a couple of sketchy people on the bus, and I agree, you know, they may be dangerous, but look at that guy over there. He's smiling, and look at that kid. He's playing his video game. He doesn't even know you're alive. So now only half of the people on the bus want to kill you. So by chipping away at some of the delusional thinking and looking at evidence, we're able to help people to cope with some of the thoughts that they have. We also work with hallucinations that won't go away. So we work on issues of sort of mindfulness, allowing that voice to be there. Or we work on distraction techniques like listening to headphones. And we try different experiments to see which one of those things is most helpful to the person. So CBT has been shown to be effective in reducing the distress that's caused by some of the positive symptoms that we can't quite treat to extinction with medication.
And do you find that most of your patients are amenable to psychosocial treatment?
I think the patients really like psychosocial treatment. They're very, this whole thing with COVID has caused a lot of us not to be able to make home visits, and they really look forward to those visits. I believe, you know, we talked about earlier how the treatment team kind of becomes the family for some of these people. So I think that they really look forward to our visits. They really get a lot out of that interaction. And so I think psychosocial treatment is really welcomed by most people with schizophrenia.